Health Minister Dr. Zweli Mkhize says African countries should prepare for the impact of a possible third wave of COVID-19 infections. Professor Veronica Ueckermann speaks to us about how the country, of course, can start getting ready for this. Good evening, Prof, and thank you so much for your time tonight. That's going to be one of the big issues that the President is going to have to contend with tomorrow when he delivers the State of the Nation address, because if what the experts are saying is anything to go by, it seems unlikely that we'll get through 2021 without experiencing a third wave of this virus.
Good evening. Yes, that is unfortunately quite right. If you look at the virus dynamics as it stands now, a third wave is unfortunately likely, and perhaps even a fourth wave, depending on the way we pan out through the year. So preparation certainly is very important in getting ready for this third wave. And even though we've got a vaccination campaign underway, I think even the best countries couldn't possibly vaccinate quick enough to prevent a third wave, and we're probably looking at a third wave at the beginning of winter.
When we talk about preparations for this, what are we referencing here? What needs to be in place that perhaps hasn't been done in the last year that we've been facing COVID-19?
So I think to start with, one should also focus on what has actually been done. So if you think that the second wave was quite a bit bigger than the first wave, we have a lot of things in place already, both in state, private, all sectors, that we can draw on for our third wave. So really, if you're looking at preparations, you need to look at processes, equipment, and staffing. So I think for us, the processes certainly are, we've had a lot of practice now between the two waves. And one of the processes we are initiating is vaccination to try and prevent further disease. In terms of equipment, I think there's been a very big private and public collaboration in terms of getting equipment for hospitals and getting the necessary training for that equipment in various of the state sector hospitals as well. So even in the second wave, I think we were better off in terms of ventilators that were procured, high-flow machines, equipment that we needed. But another important preparation strategy is, of course, staff. And this is twofold. I think we've had recruitment of a lot of new staff, nursing staff, doctors, junior doctors who have joined the system and ready to go and are being trained to deal with the third wave. But we've also got to look at our frontline staff who have now really dealt with two waves and probably had a degree of burnout throughout the country. So giving those staff members some respite and training some new ones to take the forefront with them, I think is very important. And those three aspects we need to look at when addressing our third wave preparation.
Sure. You know, all of these ideas that you've mentioned effectively come into play and are effective when we are dealing with an increasing number of people who have been infected with the virus. Are there different strategies that we can employ, in particular the approach to primary health care in our communities, that could ensure that less people perhaps are more vulnerable to COVID-19 when it does come around?
Absolutely. I think, at a community level and for all of us, education and leading by example is critical. So understanding the basic principles, the thing about COVID-19 is it all comes back to those basic principles. So when we let our guard down, when we relax a little bit and social distancing, mask wearing, sanitizing goes by the wayside, that is really where we do have a lot of difficulty. I think with the second wave, our screening efforts were also quite, a lot bigger than the initial wave was. Community screening, early isolation, facilities for isolation. If a family member is infected and they're not in an environment where they can protect their families, all of these things are certainly primary healthcare things that we can look at. And then, of course, in the greater picture, looking at vaccination strategies for everybody in the community eventually, and we're aiming for herd immunity or at least coverage of 67% of the population. That's a mammoth task, and that will really certainly involve a lot of primary health care.
Professor Veronica Ueckermann, she's the head of the COVID-19 response team and adjunct professor at the University of Pretoria's Department of Internal Medicine and Steve Biko Academic Hospital. Thank you for your time tonight.